If you've tried physical therapy, injections, procedures, and trial and error with different doctors and this and that, one reason it's probably not going well is because it's possible, and again, in my clinical experience, I get lots of clients that have already been through all that, you don't have a professional or clinician addressing the root cause and looking at your body globally. Again, just like the knee we talked about, let's assess every body part and help the entire body work better. That's going to help that region work better. That's what we're missing a lot of times in this chronic pain type situation. It's really a holistic approach to this, okay? Let's talk about for a second chiropractic and osteopathic care. Big fan of those practitioners there. We've got family chiropractors. I know osteopaths. Had some great training by some osteopaths. I think it's great medicine, right? The issue I have with both concepts, though, in general, is that it's very good at treating, again, a subluxation, which is when a joint is out of balance. That does cause inflammation and pain. It can, for sure. It's great at that. The problem is I see with that system, though, I just not have seen, and for most of those clinicians that practice that, a lot of follow-up care. I just haven't seen them really follow up and say, you know what, let's look at that ankle, that knee, that back, your breathing pattern, and let's look at a program to look at those other global factors, again, holistically, and see what we can do to help less force end up at that knee joint. Again, I keep beating on the knee, but I just want to give you an example where if we can look at these other things, you'll have less forces being sent to the knee. Therefore, the knee has to do less, needs less stability. It can start to heal. It has less friction, for example. And so, again, is there a place for those practitioners? Absolutely. I still refer out to chiropractic care for, really significant spinal issues for sure. Osteopaths, if somebody's dealing with some really big acute pain, especially from a car accident, once we're out of the woods as far as like the emergency department, definitely see an osteopath for a little while to, when you're dealing with things where you can barely move, or physical therapists. Again, I know some, a couple good physical therapists as well. But again, on the front end, that can really help. Long term, though, are we looking at the entire picture and helping you heal in all these areas? Okay, we're going to expand upon that more and help you understand why a holistic approach is going to be more successful long term, although it may take longer.